And welcome to the Dr. Bob Show. We'll be spending most of the show talking about spring allergies. Why do spring allergies cause so much problems, and what can we do for them? Changes in the atmosphere are making spring allergies worse. There's more pollen and there's more symptoms, and we'll learn what we can do to solve those symptoms and make people feel better. My guest is Dr. Laura Green. Dr. Green is a board-certified allergist, and she answers questions on spring allergies every single day. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about why the best prescription for your heart may be exercise, and what does exercise do for your heart? And an old question that comes out of every house: how can I stop snoring? A lot of information for you on this show. You're going to want to stay tuned. We're talking with Dr. Laura Green, board-certified allergist, and we're talking about spring allergies. Laura, welcome to the Dr. Bob Show. Why do people call spring allergies hay fever? What does hay fever mean?
So hay fever is a little bit of a misnomer, but that's historically what it's been called, because with allergic rhinitis, you do get a lot of symptoms that make you feel like you're ill. You get runny nose, you get sneezing, you just don't feel well, but you don't necessarily have a fever.
Is hay involved with spring allergies?
It can be, but it could apply to anything in the air that you're allergic to that's causing symptoms.
So what are the most common things that cause problems in the spring, March, April, May?
So we see spring allergies attributable a lot of times to the pollens, especially trees and grasses.
So trees, now, is it just the pretty trees that cause the problems, or any special kind of tree? And what's the tree flower like, and where does the pollen come from?
So it's actually trees that you might not even think about, because the trees that are especially allergenic are those that are wind pollinated. So they don't necessarily have pretty flowers that attract bees and insects that help with pollination. They have to put large amounts of pollens into the air so that they can be dispersed. And that's what causes a lot of trouble for people in the springtime.
What does pollen look like?
Well, you might see it all over your car in the springtime. You'll see yellow.
Stuff, you can write your name on it. But when you look at the individual grains, they're very, very small.
They are. They're very small, on the order of microns, and some of them may be 15 to 20 microns in diameter. Some may be up to 75 microns in diameter. That's very small.
They spread well in the air?
They do, and that's one of the things that makes them allergenic, is that they're easily dispersed.
So when something is allergenic, and pollen is something allergenic, what do you mean by that? What does the pollen do that produces allergy symptoms?
So you'll breathe these things into the respiratory tract. When you're talking about hay fever or allergic rhinitis, you're drawing these things into the nasal tissue, and they're sitting there and they're causing an allergic response in the nose.
And the allergic response that occurs in the nose to the pollen that sits there, what's going on? What's happening? What's it producing that makes us have symptoms?
So early symptoms, you're going to notice that you'll have sneezing, you're going to have itching, runny nose. And then you'll also get congestion later.
Now, I sneeze every day. Is there a certain type of sneezing that somebody has in the spring? Is it fits of sneezing, paroxysms, or you just sneeze here, sneeze there?
It could really be either, but a lot of times if you have sneezing that just is really chronic and almost habitual, then it could be attributable to allergies.
Usually is attributable to allergies? It depends.
It could depend, because there are also respiratory viruses that can cause sneezing, and sometimes it's just hard to know early on which it is.
So if you've got a runny nose, is it usually clear, or is it discolored runny nose?
If it's just allergic rhinitis, we would expect it to be clear drainage, just clear, drippy drainage.
So sneezing, does the nose itch?
The nose should itch.
What's an allergic salute?
We call an allergic salute this right here, where you wipe your nose upwards. And frequently, when you know that people are allergic, they'll get a little line across the bridge of the nose called a horizontal crease, and that's from the allergic salute.
So when you push your nose up, it's got a little crease in the middle, and that will eventually. So is that sort of a telltale sign?
It is, or it's at least one that we would really suspect that you may have allergies.
Allergic shiners, what does that mean?
Allergic shiners are what we see under the eyes, the dark circles under the eyes that result from chronic nasal congestion. And you may even have some little lines right here below the eyelid called Denny's lines.
So we've got puffy eyes, we've got dark circles under the eyes, we've got itchy nose, we've got a horizontal crease, we've got an allergic salute. How about the roof of the mouth? Does it cause any symptoms at all? Allergic nose?
You can get some symptoms along the roof of the mouth. You can get changes in the dentition, especially in children from tongue thrusting that goes along. They might get an overbite.
And so the dentist fixes the overbite, but if the allergy is not fixed, it comes right back. That's a key thing. Are the ears involved with allergies?
Yes, they can be. We see a lot of times itching in the ears. Patients may also get pain in the ears from eustachian tube dysfunction, which is inflammation in the tube that connects the back of the nose to the ear. And allergies cause that little tube to get inflamed. That creates some pressure problems and pain in the ear.
So how common are allergies? Are they more common at a certain age, or boys or girls, or at age 3, 4, or 5, or later on? Or when do spring allergies start and occur?
Well, we really start to see them a lot of times in childhood. Now, we also see adults coming in with symptoms as well, but kids frequently will start out with a little eczema when they're babies, and then by the time they're 3, 4, or 5, they start to have symptoms in the nose, and it just marches along. We call it the allergic march, where their symptoms are kind of stepwise.
It can be nose, it can be skin, can it be...
It can be asthma
Can
as
be
well.
asthma too. Just briefly, what is asthma?
Asthma is an obstructive type of inflammation in the airways that causes air trapping in the lungs, so you don't get air out of the lungs as well.
So you get cough and wheeze and short of breath and tight chest. That could be fairly scary for a parent of a young child with asthma. Is asthma a serious spring allergy?
Yes, asthma would be considered a more serious manifestation of allergic disease.
So if somebody has got spring allergies, how do you know if it's a certain tree, or does it matter if it's a certain tree, or what other spring allergies are there later in the spring?
So trees would be one thing. We also think of grasses as being a spring allergen. And in this part of the country, we start to see grasses pollinating usually by the end of April, and then they go throughout the summer.
People worse during grass season or worse during tree season, or everybody's different?
It really just depends on what your problem allergens are and what you're sensitive to.
So how do you find out what somebody's allergens are? By the history, by the physical, or by allergy testing?
It's all important, but we can categorize what someone's allergic to based on allergy skin testing.
And what's the skin testing like?
So we have the patient get undressed and we put little scratches on their back to start out with, and we basically scratch the surface of the skin with an extract made from these allergens.
When you scratch it, is it a long scratch or is it just a little pluck?
It's just a tiny little scratch.
Cause any bleeding?
Does not cause bleeding.
Painful?
It's not painful. Now it can be irritating because if it's positive, it's itchy, and that can be pretty uncomfortable.
How long does it take the skin test to develop red itchiness?
We look for that to happen within 15 minutes.
So you put the scratch test on, and then 15 minutes you can look and see if it's oak tree or Bermuda grass or whatever you're skin testing to in the spring of the year.
Right. So patients know by the end of the visit, number one, if they're allergic to things, and number two, what they're allergic to.
Is there good treatment available for people that are having spring allergies?
There are great treatments available.
And that's what we're going to be talking about. There are great treatments available. What are the great treatments for spring hay fever? A lot of information. We're talking with Dr. Laura Green, board certified allergist. We talked about spring allergies. It's tree pollen that gets in the air. It's grass pollen that gets in the air. It causes runny nose, sneezing, itchy nose, the allergic salute, a crease in the nose from rubbing the nose because you're so miserable with it. And then we talked about medications, and that there are great medications. That reasonable summary?
Sounds good.
Let's talk. So let's talk about what is the treatment. If you've done skin testing and you find out what they're allergic to, and they're allergic to tree pollen and grass pollen, what do you tell the patient as far as how to treat?
So treatment's really a multifactorial approach. One thing that we talk about is avoidance. Can you avoid things that you're allergic to? That becomes easier sometimes when you're talking about pets. If they don't have pets in the home and they're allergic to pets, they can avoid getting animals for the house. Pollens are hard to avoid. They blow for 200 miles sometimes. You can't cut down an oak tree in your backyard to avoid oak pollen. Molds are present in abundant quantities outside. You can't avoid that. Dust mites you can't completely avoid, but there are some avoidance precautions you can do for your bedroom and for the inside of your house. So avoidance is very important. Another thing would be medications. There are some great treatments available over the counter and by prescription that patients can do for allergies. One would be a non-sedating antihistamine tablet or liquid that they could take on a daily basis.
So they're liquids and tablets that don't cause drowsiness that people can take. What are some examples?
Some examples would be things like Zyrtec or Claritin or Allegra. Those are all available over the counter, and they're the same as what is given by prescription. So sometimes if it's prescribed, insurance will cover those even though they're over the counter.
Are there side effects to Allegra and Claritin and Zyrtec?
They should be well tolerated. Now, they are non-sedating. They are listed as non-sedating. Some patients still feel like they have some sedation with those medicines.
What does the antihistamine tablet do? What symptom does it relieve?
It really is gonna help more with the early phases of an allergic reaction, which is the itching and the sneezing and maybe some of the runny nose.
You say with the early phases. Are there early and late phases of an allergic reaction?
There are. An early phase of an allergic reaction is almost immediate. It happens within minutes of encountering an allergen in the air that you're allergic to. A late phase is what's going to happen much later, several hours later, and that primarily is going to be the congestion and the stuffy nose.
So you get the itching and the sneezing at first, and then you get congestion. What bothers people most? The itching drives me nuts, or the congested, stuffy nose, can't breathe?
A lot of times it's the stuffy nose that really bothers people. Both phases are going to be aggravating, but it makes it really hard to rest and get good sleep when you can't breathe through your nose.
So how effective are the antihistamines on the congestion, the late phase reaction?
They're not going to be as helpful for that. They're not going to prevent that as well.
So what would you use?
So another option over the counter would be a steroid nose spray, something like Flonase or Nasacort or Rhinocort.
So what do those do?
So they're very helpful and they're anti-inflammatory. And so what that means is that they do help prevent that late phase. The nose sprays, the steroid nose sprays in particular, are going to be a bigger bang for your buck when you're talking about allergy medicines because they help prevent the early phase of an allergic response. They also help prevent the late phase of the allergic response.
So it really helps on both.
Right.
So if you had one to pick, you would pick
the nose spray.
The nose spray.
But a lot of patients don't like using a nose spray every day.
They don't, do they? That amazes me, even though it may be the very best thing for them. Is there a way that you instruct people to use the nose sprays?
Yes, it is much more beneficial to try and treat the part of the nose where you have the tissues that get swollen. So when patients use their nose sprays, they should lean over, they should aim towards the back of the head and at a slight angle towards the ear. They will be a little less likely to get nosebleeds that way, and they'll really just be more effective if used that way.
So how long does it take the Flonase or the Nasacort or the over-the-counter cortisone nasal spray to work?
They start to be absorbed pretty immediately, but they do take a little while for the anti-inflammatory effect to work. So it takes a couple of days really before they're even that effective.
So in general, if somebody has got a score of 10, which is the worst they can be, and you put them on an antihistamine and a topical nasal spray, what do you expect?
We would expect their symptoms to improve. We wouldn't necessarily expect their symptoms to go away.
But if they improve, it makes them where they exist a whole lot better. So let's say we didn't have any medicines. We didn't have nose sprays, we didn't have antihistamines. What would the allergic symptoms, how would it affect the patient other than just sneezing and itching?
So a lot of things that we hear about are fatigue, and that's a big one for patients with allergies. When your nose is swollen and you don't breathe well through your nose, you tend to be a mouth breather. Mouth breathers snore at nighttime, and when you snore, you really get poor sleep quality, which means you don't rest well. During the day, then you're tired and you're just fatigued, and you don't feel like you have a lot of energy.
Do studies show that people don't perform as well at school with their grades or with their productivity at work?
Yes, studies show that.
So it's really important that you get medicines that work. So if the medicines don't work, what can you do to help?
So another option would be to put patients on allergy shots or allergen immunotherapy. And that's where we desensitize patients, so to speak, to things that they're allergic to, so that they don't have that same hyper-reactive response when they breathe these things into the respiratory tract.
Do the shots work immediately, or is it a slow, gradual thing?
It's a slow, gradual process. We have to start patients off at a very dilute concentration of allergy shots to minimize their risk of having an allergic reaction to shots. It takes several months before they will even reach a full strength dose. So it does take a while, and in that beginning period, medications are still very important.
So you have to take medicines and shots if your allergies are bad enough to where you need to do that to get to feel better. How good are the shots?
The shots are very effective. We usually tell patients that they could expect about a 50% improvement in their symptom profile in the first year. That goes up dramatically in the second year and the third year on shots.
So we've got a 2 to 3 year program, and we expect somebody to be doing pretty good at the end of 2 or 3 years. Let's flip a little bit. We've talked about antihistamines, cortisone nasal sprays, allergy desensitizing shots, immunotherapy. What are some of the side effects that people can get because their nose is congested and swollen?
One thing would be chronic sinus infections.
Why do sinuses get infected if they've got a bad nose?
Well, allergies cause a lot of inflammation and just swelling in the airways, and the sinuses don't drain as well. They don't get aerated or get air to the cavities as well, and it sets you up for sinus infections.
So do the sinuses drain into the nose?
They do.
And in the nose, if it swells, can block the sinus. So is recurrent sinus infections common?
Recurrent sinus infections in this part of the country are relatively common, and they would be very common in patients who have allergies.
How about the ears?
We see patients that frequently have recurrent ear infections, and that again is because of inflammation. So you can get inflammation in the nose and in the upper airway. You can get inflammation in the eustachian tubes that connect the back of the nose to the ear.
So as I'm listening to you, I'm hearing that allergies can be a very significant problem to somebody's overall health. It bothers their ears, they get ear infections, they get sinus infections, they don't sleep well, they get fatigue, they get malaise. How effective is allergy treatment for your patients?
The treatment is very effective. We typically tell patients that within about 3 years they should have up to a 90% improvement in their symptoms.
It must be a good feeling to be able to see somebody who's miserable and then be able to treat them and watch them improve and get better and be much more productive.
Yes.
Laura Green, you're a wonderful teacher. Thank you so much for coming to the Dr. Bob Show.
Thank you.
It's been great information for everybody. Thanks. Now you're going to want to stay tuned. We'll be talking about maybe the best exercise for your heart health would be exercise for the best prescription, and how do we get rid of snoring? There are lots of ways that we can do it, so you'll want to stay tuned for that information. I want to thank Dr. Laura Green. Wonderful discussion on spring allergies. Good treatment for it. Now, a question from you, the viewer, that I think will be important to your health. Question number one. Dr. Bob, could you explain the benefits of exercise for the heart? Well, it's an excellent question. And if we could give one prescription for the heart, probably exercise would be the best one. It needs to be continual exercise. It would be better if you do it for a longer period of time rather than 5 minutes at a time. Do it 30 minutes and do it 5 times a week. If you can do that, any type of exercise is good. More pain, more gain. So the more active you are, the faster you walk, it will be a little bit better. So what seems to happen with exercise? Well, number one, we lose sodium when we perspire. That helps the blood pressure. With exercise, the blood pressure falls. And when the blood pressure falls, the heart doesn't have to work as hard against it. Bingo, that's number one. Number two, when we're exercising, the body has to work harder and the heart has to work harder, and it will develop new collateral circulation. So it will form new blood vessels that would be available if some begin to be closed off later on in life from hardening of the arteries. Bingo, that's number two. Number three, exercise is an excellent way of reducing your cholesterol, the lousy cholesterol, the LDL. Exercise is an excellent way to cut that down. So that's number three to benefit the heart. When we exercise, the heart actually puts out a substance, a hormone called an endothelial growth factor that lines the lining of the heart, and it makes it where the heart is protected from disease. As we exercise, it helps us lose weight. It helps us lose stress. So those are additional benefits for the heart. So when we think about regular exercise, we think about the heart and the huge benefits that it gives us. So make exercise part of your program. Be sure you get those tennis shoes out of the closet and you start walking, or you swim, or you bike. Do it with a friend. You'll be able to meet somebody at a set time and you'll make your exercise a regular thing to do. Question number two. Dr. Bob, my husband snores. How can I get him to stop? Common question. The person on the other side in the bed at time of sleeping, if they snore, it will make it difficult on two people. Number one, the snorer, and number two, the person that's trying to sleep beside them. People that are habitual snorers and loud snorers frequently have sleep apnea. That's where when they snore, the back of the throat closes against itself and people actually stop breathing for 5 to 10 seconds. When that happens, they lose oxygen, the pressure in the lung goes up, oxygen supplying the heart goes down, and it really puts a stress on the heart with obstructive sleep apnea. The adrenal glands will begin to put out hormones to protect the body, and those are adrenaline, norepinephrine, and that will raise the blood pressure. Sometimes the heart will become irritable at nighttime when somebody has sleep apnea. What can we do for snoring? 3 basic things cause snoring. Bad nose, so we can find out what's bothering the nose. If it's allergies, we've got medicines that we've talked about that can help that. If it's a crooked nose, an ear, nose, and throat doctor can help straighten that. A bad throat. The throat, if the soft palate falls back against the back of the throat, it makes it easier to snore. Bad belly means we've got to really work to pull in air because of the diaphragm. So if our tummy is too big and we're trying to breathe, then we have to suck in on air, and when we do that, we will begin to snore again. So we can lose weight, we can fix our nose, we can fix the throat, we can sleep on our side. Sometimes people will actually sew a tennis ball on a t-shirt that they sleep on at nighttime, and people will feel uncomfortable and they'll keep on their side. So there's lots of things that we can do. If you're snoring and you have sleep apnea, you may need to see a sleep specialist. That sleep specialist will see what's going on with your sleep, and he will be able to tell you if you need a CPAP or if you need something to help you sleep at nighttime. He'll also be able to look at your throat and look at your nose and decide if you need to have those corrected. So know if you've got snoring. There's a lot of things that we can do. Talk to your doctor about it. Get rid of that snoring. Make your nighttime sleep healthier and happier. That's all the time that we have for this show. Remember those 4 things that we always look for. Number 1, exercise. Exercise is probably the most important thing that we can do. Lowers blood pressure, lowers stress, helps us lose weight, helps our heart, helps us feel better. 7.5 hours sleep. Everybody needs sleep to be effective. So if you get 7.5 hours sleep, make it good sleep. You'll find that you'll perform better the next day, and the people around you will also be able to perform better. Eat properly, eat foods, a lot of fruits, a lot of fiber, less fried, fatty, greasy foods. So we all know what we should be doing. Eat properly, exercise properly, sleep properly, and most of all, what is it we like in the Dr. Bob Show? Well, it's that laughter in your life. Find somebody that you love, that you can tell stories, that you laugh and you giggle, because the more you laugh and the more you giggle, the healthier you're going to be.